There are many more people in Connecticut than are infected, at this point thousands, than what we have in terms of confirmed cases.
That is the state epidemiologist, Dr. Matthew Carter. State leaders tonight are telling us the numbers we are getting are only the tip of the iceberg. Here's where things stand right now. Tonight, there are 875 confirmed cases of coronavirus here in Connecticut. 113 people with the virus are now in hospitals, and 19 people have died. This map here paints a picture of how the cases are spread out around our state in all 8 of our counties. But of course, the bulk of them near New York City in Fairfield County, southwestern Connecticut. And you can see Hartford and New Haven have the second highest number of cases there. Our team coverage begins with Channel 3 Eyewitness News reporter Matthew Campbell. He was at the briefing today, but I'm going to sum up what he had to say, and now we do have him available. He's live at the O'Neill Armory. Matthew, some confusion as to whether or not you're available, and obviously you are. Take it away.
Yes, Dennis, thousands are self-quarantining right now. Thousands are out of work. So the financial fears that many are experiencing across the state, they are real. And a lot of that was addressed in the news briefing earlier today. There is a 3-week backlog for unemployment payments. The governor is aware of that. He says he's devoting all assets to help unclog this. And that does include shifting responsibilities at the Department of Labor and even bringing people out of retirement in hopes that the delays will not be too long. Now, small businesses will be getting a lifeline in the form of a loan. First, for businesses with 100 employees or less, the state is offering a no-interest 18-month loan to cover 3 months of operating expenses. Now, this caps out at $75,000. For businesses with 500 employees or less, they have a federal loan program. Businesses can apply for a loan that's 2.5 times a monthly payroll. So if employment is maintained for 8 weeks, that loan turns into a grant. They do not need to pay back that money. Now, one of the biggest concerns throughout the state remains the issue of borders. In the last few hours, we have the first selectman of East Lyme recognizing that many people are fleeing New York, New Jersey, and Fairfield counties and moving to the shore. He's implementing a 14-day self-quarantine. The governor is not closing the borders, but is urging people as strongly as possible to stay home. Dr. Matthew Carter says this is why.
Well, this is what we know. We know that the number of cases overall doubles every 3 to 5 days. And the number of cases that we see, the ones that are confirmed to be positive for COVID-19, are just the tip of the iceberg. And there are many more people in Connecticut than are infected, at this point thousands, than what we have in terms of confirmed cases.
So the cases here in Connecticut continue to rise, but there is some relief for the medical community. In the next 48 hours, the governor says a big supply of medical supplies will be coming into our state. That is the latest. Live here at the Armory tonight. Matthew Campbell, Channel 13 News.
Okay.